Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now, I've been bombarded with questions regarding two of the CDC's 11 symptoms of the coronavirus. Now, these symptoms are both loss of taste and loss of smell. Now, I've received an overwhelming amount of chat requests from individuals interested in finding out if acupuncture can help with these symptoms. Now, I've chosen to respond to only 3 of the more popular questions of many, but before doing so, I must say, if you're experiencing loss of taste or smell, please see your primary care physician immediately to discuss the matter. Now, have I ever treated someone who's lost their sense of smell or taste? Yes, I have. Most patients in which I treated with these symptoms were not as a result of a respiratory infection, including COVID-19. My success with treating these symptoms have been pretty much hit or miss. But let's dive into the 3 main questions I've been asked over the past few weeks regarding these symptoms. The first is loss of taste or smell a common symptom of COVID-19? Now, I've been hearing from some of my allopathic medicine colleagues that somewhere in the ballpark of 70 to 80% of those who tested positive for this virus have expressed having experienced loss of taste and smell. Now, loss of smell and taste does not necessarily mean that you become infected with this virus. Loss of smell can be associated with such conditions as a simple cold, a sinus infection, or early stage Alzheimer's or Parkinson's disease. There are studies that indicate that loss of smell have been present, let's say, in as low as 35% or as high as 97% of individuals who have been hospitalized as a result of becoming infected with this virus, which is far greater than those infected with other respiratory infections. Now, another question is, what serves as a cause of these symptoms in those who have been infected with COVID-19? Now, I have not gone that far as, let's say, researching this virus from an allopathic perspective. Now, from a Chinese medicine perspective, I as an acupuncturist have to diagnose what aspect of yin and yang have been negatively impacted as a result of this exterior pathogenic factor. How does this pathogen play into one's constitutional deficiency? What aspect of the human organism affected serves as the root, and what serves as the branch in their case? Because everyone's constitution is different, whereby you may have certain channels that are constitutionally stronger than mine when it comes to fighting off certain pathogens and vice versa. And I also have to determine which yin organs may need to be tonified or nourished or reduced, which meridians may be overacting, counteracting, or insulting other meridians, as some of many ways I may approach my point of diagnosis. Whenever you get a moment, either go to my website to gain a better understanding of acupuncture, or simply go over some of the earlier episodes on this channel to also gain a better understanding of how it all works. Now, the third more popular question is, what if someone only experiences loss of taste and smell and none of the other CDC's 11 symptoms of coronavirus? My answer to that is it's best you sit with your primary care physician to determine the actual cause of those symptoms to give you a clearer understanding as to how you would like to approach some sort of treatment. Of course, I'm going to throw in the biggest question of all, which is, how did I approach treating patients who presented with these symptoms? Now, I'll go back to say, as I said earlier, my success has been that of hit or miss. I would incorporate Chinese scalp acupuncture using sensory points on the head to support body points, as well as recommended Chinese herbs. I would use 4 points on the governing vessel of the body that restores sense of smell, and 2 points on the conception vessel of the body that restores taste. Then I would focus on nourishing yin and clearing heat, but there are plenty of acupuncturists out there that are great at treating these symptoms. But I also hold steady in saying you should see your physician, who may possibly refer you to a specialist depending upon the severity of your symptoms. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?